Hi everyone, I am Dr. Andi and it is time for today's Facebook Live. I will be answering all of your keto questions. This is always one of my favorite times of the week. I love answering your questions, hearing your stories. I love to hear you share your experiences with me. So while we take some time and allow everyone the opportunity to log on, I'll just give you an introduction and a little background into who I am, and then I'll get started answering all of your questions. So I am a naturopathic physician. I have been practicing in Toronto for over 10 years now. I personally have been keto for, I always say over 10 years. It's been about 15 years now actually that I personally have been keto. And those are my own health issues, digestive issues that sort of led me down that path. I kind of stumbled along keto. And in practice, I started to focus more on sports medicine, sports nutrition. I was a personal trainer, I was a dancer, I did martial arts. And so that was just sort of the natural flow of my practice. And then I started to move more into hormonal balance, metabolic nutrition. But as a foundation, I always incorporated those lifestyle practices, specifically keto, into my practice. It was sort of the foundation of what I've done for a lot of my protocols. So I love to share sort of those clinical applications that I use for the ketogenic diet, how I use it in practice, the results that my patients see as well. I work in a clinic with about 19 other practitioners. It's a functional integrative clinic, and so we work in integrative teams, but all of us function from the standpoint of low carb keto. And then obviously now, of course, I've started to incorporate exogenous ketones into my practice, which was a huge change for my practice and for my patients. For anyone who's tried to follow the ketogenic diet, it can be a little bit difficult to follow. It can be a little bit challenging for some people. So the exogenous ketones really did make a difference, allowing people to move into nutritional ketosis even if they weren't following a ketogenic diet. So that's something that we've all incorporated and used as a foundation. And some of our main protocols and our main focus in practice is definitely metabolic nutrition and weight loss, but we do a lot of cognition and anti-aging, and a lot of chronic illness, fibromyalgia, chronic fatigue, and Lyme disease as well. Those are sort of very primary focuses with the keto foundation in there as well. So I am going to get started. Some of your questions are already coming in, so I hope I get to all of them. I know I try and make it to all of them. I miss some of them, so just keep typing. Hopefully I'll catch it at some point. So I'm going to get started. So the first question that I've gotten today is, can taking ketones affect your blood sugar levels if you are diabetic? And the question was, would it increase your blood glucose levels? No, it should not increase your blood glucose levels. Exogenous ketones have actually been shown to decrease blood glucose levels. It improves insulin sensitivity as well, so it's been shown to do the opposite. So if you're finding that somebody is diabetic, they're taking exogenous ketones and they're seeing an increase in their blood sugar, I would actually get them to start doing a food tracker and tracking their diet as well, because again, this shouldn't cause a spike. It really shouldn't cause a spike in your blood glucose levels. And so I'd also have them work with a provider who is well versed in the ketogenic diet, who can really help to make sure that they're doing that diet properly. When it comes to diabetics, type 2 and type 1, those are the individuals who do have to be cautious taking exogenous ketones. They have to make sure they can that they are controlled diabetics, taking their medication and monitoring blood glucose and blood ketone levels. You'll often hear the term diabetic ketoacidosis. That cannot happen. It does not happen if that does not happen if you have insulin in your system. So it's very important to make sure that you're a controlled diabetic. So I'm getting questions also about thyroid. Lots of questions on thyroid function. Actually, I'll answer the one about how quickly we should drink the ketones first. The ketones are actually quite stable. You don't have to drink it all within, sort of a 5-minute gulp for those who can't really drink it that quickly. You can space it out over a period of time. If you space it out though, I do encourage try and drink it within an hour. We want to make sure that you get an elevated blood ketone level that is high enough to give you the benefits that you're looking for. Some people like to sip it slowly throughout the day, and if that works for you, that's great, but I often encourage drinking in shorter periods of time to get those higher levels of, to get those higher blood ketone levels. So a question about thyroid. Will exogenous ketones impact the thyroid? There's often concern with the ketogenic diet and thyroid function. When it comes to exogenous ketones, we haven't seen any evidence that it negatively impacts thyroid function in any way. The concern is often for those who are following a ketogenic diet. Does that negatively impact thyroid? And the only time I find that there's a disruption in thyroid function is if somebody is doing the ketogenic diet incorrectly. So if somebody, for example, is just following a low carb and low fat diet and all they're eating is, chicken and lettuce all day long, they're not getting the fats in, that's where we'll start to see hormonal imbalance. It's very important to get your fats in. That's how our body makes hormones. Once you start to disrupt your sex hormones, like your estrogen and things like that, you'll start to disrupt your thyroid hormone. So if you're not following the diet properly, yes, absolutely, you can see disruption in thyroid hormones. So, but from an exogenous ketone standpoint, we don't see any disruption in thyroid function, and as long as you're doing the diet properly, you'll often hear people use the term, lazy keto or things like that. They'll use different terms like that. So the ideal, if you are also following a ketogenic diet, is you follow a healthy keto diet, having a lot of plant-based fats and things like that. So, and we find that won't cause a disruption in your thyroid hormones. So taking exogenous ketones and kidney function. So essentially, when a lot of people get concerned about the impact of exogenous ketones on kidney function, can that negatively impact your kidneys? So we don't have any evidence to show that exogenous ketones are detrimental to the health of the kidney. If you do have some kind of medical condition, you have to talk to your healthcare provider. And in terms of a ketogenic diet, they've actually done research looking at people on dialysis and found that those on dialysis actually have better outcomes when they are following a ketogenic diet. So there actually could be benefit when it comes to kidney function in the ketogenic diet. But again, if there's a medical condition, you have to talk to your healthcare provider. So once you're keto adapted, will you be able to detect ketones on a urine strip? It's a great question. I always encourage people to check their ketone levels through blood. It's just a simple finger prick, and that's how I want everyone to check their ketones. Once you become keto adapted, your body will release fewer ketones through the urine. Ketones are water soluble, so they're not going to get stored as fat. You can't accumulate the ketones in your system. So if you have too many, your body will just eliminate it. But once you become keto adapted and you become more adept at making use of those ketones, your body's absorption is enhanced and you will release fewer ketones in your urine. So often you'll hear people say, I don't think I'm in ketosis anymore. Why am I not getting a reading on my urine strip? And it could be because your body is actually just using them. So I would encourage you to switch to use a blood meter instead and check blood ketone levels instead of urinary ketone levels. So inflammatory bowel disease. So for inflammatory bowel disease, we get a lot of questions on that as well, specifically Crohn's and colitis. And we know that exogenous ketones and beta-hydroxybutyrate has an impact on the gut microbiome, and it's actually been shown to encourage the production of healthy gut bacteria. And they've also done some research looking at BHB specifically in Crohn's and colitis, and they have found some beneficial impacts from that. Again, exogenous ketones will not cure any medical condition, so you have to work with your healthcare provider, but there has been some research to show that there could be benefit. There's some research looking at the anti-inflammatory component of beta-hydroxybutyrate, especially when it comes to inflammatory bowel disease. So the studies, there is a lot of research happening in that space, so it could be something that's beneficial for you, but again, you have to work with your healthcare provider. So exogenous ketones in someone looking to gain weight. So I guess it depends on the type. So absolutely, there are still benefits to ketones that extend far beyond just the weight loss component. We get a lot of people who come into the keto conversation, ketogenic diet, exogenous ketones, due to the fat loss benefits of ketones or the ketogenic diet. And I always like to remind people that ketones are not a weight loss supplement, but you experience fat loss as a secondary benefit to what the ketones are doing in your system. So for somebody who is looking to gain weight, it also depends on what kind of weight gain you're looking for. I'm assuming muscle mass. And there is a lot of research looking into the role of ketones used pre-workout and enhancing endurance and performance. So absolutely somebody who's looking to build muscle, they could absolutely take the ketones to fuel a workout, enhance, optimize their endurance. I've also had people ask the reverse, so what if they take it, will they lose too much weight? Because some people are not looking to lose weight. So they're not looking to lose weight, so what happens if you've hit the level that you, sort of the weight that you're looking for? And again, ketones are not a weight loss supplement, so it should not cause you to become underweight or lose weight that your body doesn't need. Instead, it's balancing things that you can't see. It's balancing your insulin levels, reducing blood glucose levels, impacting our hunger and satiety hormones, impacting our appetite. So it's creating more of a balance internally, but it's not going to cause you to lose or drop weight that you can't see. So concerns about it being harmful on a ketogenic diet, I'm assuming that's a ketogenic diet sort of long term. And again, there's a lot of misconception that following a ketogenic diet or exogenous ketones can be harmful to you. There's no evidence that supports long-term keto being detrimental to your health in any way. Some people prefer to cycle keto, where they introduce some carbs and then go back into keto. But that's more just a personal choice or a preference. You can absolutely stay keto long term, and we haven't seen any detrimental impact on organ function or system overall, so that is something that you can engage in as a long-term change. And the same with exogenous ketones. There's no evidence that that's detrimental to your health. Beta-hydroxybutyrate or BHB ketones are things that our bodies make naturally. It's a naturally occurring process. Our body knows how to make them and knows how to use them. And often now when we move into that state of dual fuel, where you have ketones and carbs present in your system, and again, this was never possible in the past. In the past, the only way to have ketones in your system was through a ketogenic diet. You have in the absence of carbohydrates. With exogenous ketones, we now have the ability to have carbs and ketones present in our system at once. And what we're finding is that certain organs will choose their preferred fuel source when presented with both, and many of our organs will actually choose ketones. So the brain, the muscle, the heart will actually choose ketones as its preferred fuel source. So that's often a fuel that the body prefers. And when we look at things like concussion or traumatic brain injury, we know that our brain cannot make use of glucose, but it absolutely can make use of ketones as brain fuel. So there are so many additional benefits to having ketones in our system, and our brain, our heart, our muscles prefer them and want them as a source of fuel. And again, there's no evidence to show that they are detrimental to your health. So ketones and sleep. We get lots of questions about ketones and sleep. We have a lot of people who say all of a sudden they're sleeping a little bit better. Why is that? They've noticed improved sleep or better quality sleep. And what we've found is that a few things with beta-hydroxybutyrate. So BHB has been shown to impact our nervous system. So we have our sympathetic and our parasympathetic nervous system. Our sympathetic nervous system is that fight and flight nervous system. That's the one that kicks in when we're stressed. And so when and this is sort of an evolutionary thing, when we were, hunters and gatherers fighting for our food, our sympathetic nervous system would kick in, producing adrenaline, allowing us to sort of face that fear or fight for our food. And today our body still has that natural response, and no matter what the stressor is, we have that same stress response internally. So most of us live a very stressful, we sort of thrive on stress almost. It's sort of a thing where people are go, go, go all the time. It's a source of pride even for some people. And so we're often always in our sympathetic nervous system. And so people will say they go to bed, their mind is racing, they can't shut their brain off. And that's because we have to tap in to parasympathetic, which is that calming nervous system, the part of our nervous system that calms us down. And what they have shown is that beta-hydroxybutyrate can actually engage that parasympathetic nervous system. So there's some really interesting research looking at that sort of sympathetic anxiety state versus that parasympathetic state, and how beta-hydroxybutyrate or BHB can help us tap into that parasympathetic, very calming nervous system. And the other thing we know is that BHB encourages the production of GABA, and GABA is a neurotransmitter in the brain. Neurotransmitters are chemical messengers in the brain, and GABA is a very calming neurotransmitter. So it could be that we're seeing improvements in sleep due to turning on or triggering that parasympathetic nervous system, or because we're encouraging the production of GABA. And I'll often give GABA to patients who are jet lagged or who can't sleep or whose minds are racing. I'll give them GABA before bed to calm the mind and really calm that nervous system down. So it could be that production of GABA and that parasympathetic nervous system kicking in that helps people experience that benefit from sleep. So looking at arthritis and rheumatoid arthritis, so there's been some really interesting research looking at the role of beta-hydroxybutyrate when it comes to inflammation. And so there, again, ketones will not cure any medical condition. I know I repeat that, but I just like to be clear about that. It's not going to cure any medical condition. If you suffer from rheumatoid arthritis, you do have to work with your healthcare provider. But we know that there's research right now looking at the anti-inflammatory component of beta-hydroxybutyrate. And when we say inflammation, I don't mean you hit your wrist and you can sort of see it swelling. It's often systemic inflammation that we can't always see. And so we have these cascades that happen in our body that create these inflammatory things like interleukins and cytokines, and that cause an inflammatory response in the body. And they're looking at the role of beta-hydroxybutyrate and how it can impact those inflammatory cascades. So again, it's not going to cure any medical condition, but there could be some potential benefit with if the beta-hydroxybutyrate can impact those inflammatory cascades. So I would say to work with your healthcare provider and see if that would be a good fit for you. So can drinking too much water with ketones flush it out of your system? No, definitely not. I actually encourage drinking a ton of water with your ketones. We want to make sure that you stay hydrated. It's not going to flush them out of your system. You can mix your ketones in water. You can mix ketones in water, so you can absolutely drink a ton of water with that. Your body will still absorb the ketones, and what it doesn't need will come out of the urine. So you don't have to worry about any water sort of flushing the ketones out of your system. Will exogenous ketones affect blood alcohol level? So that's research I haven't seen. I don't know if you're wondering if it'll increase or decrease your blood alcohol level. That I'm not sure. I absolutely will not say it's going to decrease your blood alcohol level if you're consuming alcohol and taking ketones. But I'm not sure. That's sort of research I haven't seen. I can't say if that's a fact or not. I haven't done the research, or I haven't seen that, so I haven't really sort of looked into that. I will look into some research on that. But again, if it's more of a will it decrease blood alcohol level, I'm going to say no. Absolutely not. I know a lot of people will mix ketones with alcoholic beverages. So a lot of people will ask if it will decrease your blood sugar level from the sugar that you're consuming through your alcoholic beverage. But in terms of how that will impact your blood alcohol level, we don't really have any research on that. But I would say definitely it's not going to lower your blood alcohol if that's a question as well. So the opinion on epilepsy. So epilepsy is a great question. So the ketogenic diet was actually started by a neurologist. He created it to manage seizures in children suffering from epilepsy. And that was the treatment of choice for children suffering from epilepsy at the time. And then drugs came into favor, and so the diet sort of became less popular. But now the ketogenic diet is still used in drug-resistant epilepsy. So people who aren't responding to the drugs will still be asked to follow a ketogenic diet. I always encourage looking at the Charlie Foundation, checking out some information there as well, looking at the role of the ketogenic diet and epilepsy. But that's really where the foundation and the research started when it came to ketones, ketogenic diet, and then it expanded from there. And they're looking at the role of beta-hydroxybutyrate on our nerves, potentially bringing down neurotoxicity, potentially a neuroregenerative component. And they've also looked at EEGs are sort of our brain waves, and they've looked at that in those suffering from ADHD and epilepsy, and looking at sort of changes in brain waves as well. And they've noted kids with, or those who suffer from ADHD also have similar brain waves as those who suffer from epilepsy. So there could be a cross benefit there as well. So there's definitely a significant amount of research into the ketogenic diet and epilepsy, given that that's how it started. So if that's, again, you have to work with your healthcare provider if you do have a medical condition, and make sure that that's safe for you. But there has been some really great research in that space. So So when is the best time to check your blood level? So you want to check your blood level first thing in the morning before you've consumed anything. So as soon as you wake up in the morning, that's when you want to check your blood ketone levels. And again, before you've consumed anything, before coffee or anything like that, that's when you want to check your blood ketone levels. And if you're checking your blood ketone levels though after consuming exogenous ketones, and you want to do that about 45 to 60 minutes after you've consumed your ketones. That's usually the best time, just to see what your blood levels are after consuming your ketones. So if you're following a ketogenic diet and you want to see what your ketone level is, do it first thing in the morning. And then if you want to see what they are because you're consuming exogenous ketones, do it about 45 to 60 minutes after you've consumed them. So why would somebody who's ketogenic, following a ketogenic diet, take exogenous ketones? There's always a concern that if you take exogenous ketones, you're going to shut off your body's ability to produce your own ketones. And this is not the case. The body knows how to make ketones. And you'll see that there are a lot of people who have never been in ketosis their entire life and then transition into a ketogenic diet and are able to make ketones. It does take some time, but our body knows how to do that. The more keto adapted you become, the more easily you'll get back into ketosis if you do come out of ketosis. But what we're finding for those who follow a ketogenic diet and consume exogenous ketones is we're seeing a cumulative effect. So it's not that one cancels out the other or that you stop making ketones. We're seeing an enhanced benefit from the consumption of exogenous ketones when it's added into somebody who's already following a ketogenic diet. So again, the concern is often you're not going to make ketones. You will absolutely still make ketones, and we're seeing again an additive beneficial effect when they're taken together. And I believe there were some studies presented at one of the keto academies looking at somebody who is keto and taking exogenous ketones versus somebody who's following a normal diet taking exogenous ketones, and we see the best benefit when they're merged together, ketogenic diet and exogenous ketones. You will still experience benefit if you don't follow a ketogenic diet, but essentially what you're doing when you add them in is optimizing the health benefits. So fatty liver, we get lots of questions about fatty liver. It's a misconception that fatty liver is caused by consuming fats. Fatty liver is actually caused by a high carbohydrate diet. So I'll often have people come in with fatty liver and they're told to follow a low fat diet, but what they actually need to be following is a low carbohydrate diet. And consuming exogenous ketones won't lead to the development of fatty liver. A ketogenic diet shouldn't lead to the development of fatty liver either. It's actually one of the forms of treatment I give to my patients who do have fatty liver, and consuming exogenous ketones will not cause fatty liver, so that's also a concern for some people as well. So consuming ketones will not lead to that outcome. If you have fatty liver though, you do have to talk to your healthcare provider. You do have to talk to your healthcare provider and make sure that they've said it's safe for you. So how does low testosterone affect a keto diet and ketosis? So I actually find that that's the other way around. So low testosterone isn't going to affect your ketogenic diet. Your diet is going to affect your testosterone levels. So the easiest way to lower testosterone levels in a man is to have him follow a low-fat diet. That's the fastest way to tank testosterone in a male, is to take fats out of the diet. As I was mentioning a little bit earlier, we need fats to create hormones. Our hormones are made from fat, so we have to consume healthy fat for hormone production. And when they look at research and they put men on a low-fat diet, they see drastic declines in testosterone levels. And the best way to improve testosterone levels is to change their diet and put them back on a higher fat, healthy diet. So with men who have low testosterone, the first thing I'm doing is putting them on a keto diet to help their testosterone levels, because again, a low-fat diet will tank your testosterone levels. And I'm also having them engage in fasting. Intermittent fasting and some of the extended fasting will also help to increase testosterone levels in men. It won't do the same thing in women when we get concerned about that. So again, with somebody with low testosterone, it's not going to negatively impact the diet. The diet will positively impact those low testosterone levels. So that's one of the first things I'm having people do when they have low testosterone. And low hormones are usually a production of or an outcome of your lifestyle. It's also important to, again, men move into andropause the same way women move into menopause. So it's also important to look and make sure that you haven't just had a massive decline in testosterone, which you may need to replenish as well. So it's always a good idea to get those tested and find out what the source is. But absolutely, the ketogenic diet will help with those low testosterone levels. So that's sort of the first thing. That's sort of the first thing that I would have people do when it comes to an imbalance in hormones. And the interesting thing about that is when it comes to women who have PCOS, the ketogenic diet and beta hydroxybutyrate has been shown to actually lower testosterone levels. So women with PCOS are actually prone to high testosterone or high male sex hormones, and changing their diet, decreasing their carbohydrate consumption because they're also quite insulin resistant. So increasing those fats for women and decreasing the carbohydrate consumption will actually bring down those male sex hormones, which is what we need, and improve their insulin sensitivity. So I think I am out of time today, guys. That flew by. So hopefully I answered most of your questions. As always, I'll try and go back through and answer more if I can. If not, hopefully at our next event, please come and introduce yourself, share your story, and I'm always happy to answer your questions. Enjoy the rest of your week.